the next meridian, which is liver meridian. Okay, so we are already done with lung, pericardium, and heart. Today we'll start with liver meridian. And as any other meridian, liver meridian is also a very, very special meridian. Okay, so just let me note it down for you. So liver meridian is a meridian which is yin meridian or yang meridian. You can put it in the chat box. We are talking about liver meridian. It is a very good. It's a yin meridian. Okay, so liver meridian. At some places you will see that it is written as LV. Some places it is written as LIV. Doesn't matter. So what you need to understand is liver meridian is a yin meridian which has total number of 14 points. Okay, so it's a small meridian. It is a meridian which is a yin meridian. Yin meridian means it starts from the yin side of the body. It flows to the yin side of the body. Where does it start from? It starts from the foot and goes up to the torso. Okay. Why this meridian is very important? Because according to TCM, especially, liver is an organ which not only controls the production of bile and not only is involved in the chemical reactions of the body, but it is also an organ which performs a lot of emotion related functions. So many emotion related problems are controlled by liver, and this is also the storehouse of emotions. So most of the patients that come to us, somewhere or the other, they have some or the other emotional fluctuations. So in those cases, you should always think about liver. Liver is also an organ, according to TCM, that controls reproductive issues. So in those cases also, we should think about liver as a meridian. We are not talking about liver as an organ. We are talking about liver as a meridian. Now, like any other meridian, this particular meridian also has 5 shoe points. It has 5 shoe points. So when we say 5 shoe points means wood, fire, earth, metal, and water, right? Wood, fire, earth, metal, and water. And these are the wood, fire, earth, metal, water are the elements. If we talk about the energies, what is the energy of wood? Energy of wood is wind. Okay. Energy of wood is wind. Fire is heat. Yes. Earth is humidity. Metal is dryness. And water is coldness. So there is a difference between element. These are elements. These are the energies. GIES, energies. And now we are talking about the points. Points of liver meridian. Okay. So which point corresponds to the wood point or the wind energy of liver meridian? Liver meridian must be having 5 elements or 5 energies. What is the first one? That is a wood or wind energy is very good. It is lever 1. What is the fire point of lever? Fire point of lever is lever 2. What is the earth or humidity energy of lever meridian? It is lever 3. Very good. What is the metal element or dryness energy of lever? It is lever 1, then lever 2, then lever 3, then we have lever 4. And last one is the coldness is lever 8. Okay. So today we will see lever 1, lever 2, lever 3, lever 4 and lever 8. These are the 5 points that we will see. Because there are total 14 points, we are not seeing the location of each and every point. But these points are most useful points. Lever 1, lever 2, lever 3, very frequently we use. Lever 4, little less, but yes, lever 8 again. Very, very important point. Now let us start with the first point. Okay. Up to this part, is this clear to everyone? 5 shoe points, 5 energies, 5 points of lever meridian. Now we are starting with each point. Yes, thank you. We are starting with each point. So this is lever 1. When we talk about lever 1, you can see the location of lever 1. Is it very difficult to plot lever 1? It's not very difficult at all. But this particular point has a significance. I'm reading it out for you. What does it do? Lever 1 is a very important point for hernia, pain in the lower abdomen, bedwetting, urine retention, 5 types of strangury, hematuria, irregular menstruation, metrorrhagia, then prolapse of the uterus, epilepsy, coma. Okay. Out of all these, this particular point, lever 1, is very frequently used for heavy flow in the periods. This is very important. You will use this point, lever 1, very frequently for a condition where the patient complains that continuous flow of menstrual cycle, menstrual blood is there. In that case, we say that you apply a dry pea seed or you apply a cluster of methi seeds on lever 1. You will find it to be very effective. Now, where is this point located? When we plot this point, lever 1, this particular point, this is a yin meridian. How to remember the location of this meridian? See, this is one part, this is another part of the big toe. It starts from the big toe. When we say that it is a yin meridian, yin means what? It should be outer side of the big toe or inner side of the big toe? Outer side or inner side? Inner side. Okay. So this is on the inner side of, it starts from the inner side of the big toe. So you remember that it is a yin meridian. So definitely it cannot start from the outer side. Like kidney and UB, if I say kidney meridian and UB meridian, both the meridians are connected to the small toe. Okay, it is connected to the small toe. Kidney is yin, UB is yang. So which one do you think will start from the inner side? Which one do you think will start from the outer side? This is kidney. This is UB. Okay. So if I ask you which will start from the outer side. Correct. And kidney will start, will be, actually UB is ending here and kidney will start from here, according to Dr. Wall. Okay. Similarly, lever meridian. So if we are plotting lever meridian, you have to understand that, like we said in case of lung, pericardium and heart also, the point which is very close to the base of the nail plate should not be applied. This is a practical thing. According to theory, it is 0.1 kun away from the base of the nail plate. But if you apply a point very close to the nail plate, it will be very painful for the patient. Okay. The patient, many times patient complains about small blisters also close to the nail plate. So do not apply very close to the nail plate. Keep it little away from the nail plate. Okay. So that is liver 1. Is this clear to everyone? Location of liver 1. Now we move to liver 2. I'll show you the location of liver 2 also. Then I'll show you in the picture. Where is liver 2? Liver 2 is at the junction of red and white skin. So this is liver 2. You'll remember liver 2? Liver 2 is at the junction of the pink and the white. So you can say that it is at the junction of yin and yang. So this becomes liver 2. Whenever you are applying liver 2 or liver 1, do not apply the point just like that. Give little pressure, and then apply the point. Why? Because liver 1 is a very sensitive area, but liver 2 is an area where if you do not give pressure, then the seed is not going to give ample pressure because it has a web-like thing. So seed will not give too much of pressure. So give pressure. Whenever you are applying this point, give pressure like this. Apply pressure on your feet right now and feel. How do you feel? It will be a painful point for most of us. Okay. What does this point do? Liver 2. Liver 2 is located on the dorsum of the foot, proximal to the margin of the web between the first and second toe. So these are also terminologies that we need to understand. ये भी हमें समझना होगा इन terminologies को कि proximal, what is the meaning of proximal, what is the meaning of distal. These are technical terms. Okay. So on the dorsum of the foot, what is the meaning of dorsum? This is the dorsum. This is the sole, correct? This is called the dorsum of the feet. So it's written on the dorsum of the foot, proximal to the margin of the web. So if this is the web, this is a web. Web means the connection between the two toes. That is a web. Proximal to the margin. Margin means this is the margin. What is the meaning of proximal? Proximal means close. Proximal means close to. Distal means away from. Okay. So I'll give you another example. For example, if I consider shoulder joint as the focus, like in relative to this joint, if I have to mention, then I have two joints that I can compare. One is elbow joint, another one is the wrist joint. Which one is proximal to the shoulder? Elbow joint, or the wrist joint? Elbow. Elbow is proximal to the shoulder joint. This one is distal. Okay, so these are two terminologies. So these are relative terms. This will keep on changing in comparison to what is the question. Okay, so same thing on the foot also. If this is the area of focus, then proximal to the joint means very close to the joint, very close to the margin of contact on the web is liver 2. Now, what is this point doing? Indications: stroke, epilepsy, headache, dizziness, redness with pain of the eye, glaucosis, dry mouth, and other diseases due to the wind, heat of the liver. Important is, am I audible? Due to wind, heat of the liver, irregular menstruation, dysmenorrhea, metorrhagia, metrostaxis, leukorrhea, hernia, pain of the vulva, enuresis, retention of urine, Strangury syndrome, pain in the chest, and hypochondriac region. See, one point is not mentioned here, and you can just add up that point in this. and that is anger issues. No, I'm not referring to any book. I'm referring to an app, Acupuncture Index. Okay. This is a very good app. You can also refer to Treatise 2, written by Mata Prasadji Khemka. That is also a very nice book. Hmm? This is something which will not change from book to book. It will remain the same. Hmm? So though there are so many things mentioned here under liver 2, one particular thing for which very frequently we use liver 2 is anger. Why? Because after wind, that is the first point. Second point is what? Heat. So liver, anyhow, is related to anger. You remember? Liver anger, gallbladder anger. So if it is a sudden anger, suddenly comes, suddenly goes, then you say that it is gallbladder anger. If it is an anger that comes and stays for days, then it is liver anger. Correct? So anyhow, liver and gallbladder are connected with anger. And when you say that it is liver heat, heat is already more anger. So liver 2 is a very good point for anyone who has anger issues. So you can apply a dry pea seed at liver 2. You can even sedate liver 2 for that. It should be done on classical, both the feet, and use BM4 or BM5. I will say BM4 is a better option because BM5 at that location becomes little bigger. So liver 2 is frequently used point. When you are applying liver 2, see, these things are again not mentioned in the book, but practical application and practical knowledge tells you that when you are applying liver 2 here, do not use 1-inch tape. Use half-inch tape. And when you're using half-inch tape, apply the tape up to here. You place the magnet on the tape, half-inch tape, and you apply the tape up to the back part, up to this part. That ways, the magnet stays at the location for 2-3 days also. But if you apply 1-inch tape here, then it is very, very common. It is seen that it comes out within few hours also. Okay, because anyhow the 1-inch tape will cover both the toes. So half-inch tape from front to back, and you can just apply one more tape if you want to put a tape horizontally also, then another tape crisscrosswise. So that is liver 2. Liver 1, clear to everyone? Close to nail plate on the inside, not very close, little away, so that it is not painful. Yes, sedate. Liver 2 at the junction near the web, that is liver 2. Now let us come to liver 3. Liver 3 is a very frequently used point at our clinic. Why? Because this is a point that is very closely related to the functioning of liver also. So I had written a paper on liver 3, single point, liver 3, and there was, when I started the paper, I thought that I will finish it in few pages, but I had a material of almost 400 pages. And I was asked to present my paper in 10 minutes. So it is not possible to present 400 pages paper in 10 minutes. So I had to cut it short in 20 pages, and from 20 pages, I presented only 5 or 6 pages. Okay. So much of matter. I'm saying so much of material, so much of detail, so much of description and functioning and research work is available on liver 3. So liver 3 is a marvelous point. So that point should be located correctly. And what is this point? As we said, liver 3 is what? The earth point or the humidity point. Okay. So what is the location? First, I'll read out location of liver 3. Liver 3 is present on the dorsum of the foot in the depression distal to the junction of the first and second metatarsal bone. So what does it mean? First read out the first line, on the dorsum of the foot. So it is present on the dorsum of the foot. It is not present on the lower side of the foot. Okay, so it is on the dorsum of the foot in the depression. So where is this point located? It is located in the depression. See, all these are channels. Between two toes, there is a channel here. Between the next two toes, again, there is a channel here. Between next two toes, a channel here, and last two toes, a channel here. So here in the channel, this point is located. What is written next? In the depression, distal to the junction of first and second metatarsal bone. Now, in the hand, in the palm, we have carpal and metacarpal. Then we have the phalanges or the digit, correct? On the foot, we have the tarsal. That means at the ankle joint, we have the tarsal. And after that, on the foot area, we have metatarsal. Okay. So this is what? First metatarsal, then second metatarsal, third, fourth, fifth. There are total 5 bones here, like this. So in between the first and the second metatarsal bone at the junction. So if you see, if you imagine this foot where there is one bone here and another bone related to the next toe. These two bones are not parallel to each other. These two bones make a V, like this. If this is one bone, this is another bone. So they are connected at this junction. So lever 3 actually falls here, exactly at the junction. Okay, in between the two, in the channel or in the depression between the first and second metatarsal bone at the junction, close to the junction. Okay. Now, if you are pressing your lever 3 right now, how to locate lever 3? See, theoretically, in the book, it is written at the junction where the two bones are meeting between the first metatarsal and second metatarsal. But when you are touching the lever 3 on the patient's foot, then how are you locating lever 3? The very easy and appropriate and correct way of locating lever 3 is you start from the web, okay, and you keep on pressing when in the channel. So when you are pressing the channel, you can see that your finger is going inside. That means there is a hollow area here. Keep on pressing, 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 and there is a moment when you will find that your finger is touching the bone. That means after that, you are not finding any channel or depression. There is no cavity here. And if you give gentle pressure and if you gently increase the pressure, you will find that this point is more painful than any other point. This is happening with you. Try doing it on your feet right now. So this is not theoretical, this is practical class, correct? So everyone will say that, yes, ma'am, this point is more sensitive. The correct word is sensitivity. Painful. Why? Because wherever, see, if you talk about ghat on the rivers, so there are ghat on the river. River is flowing, it is bringing the water and lot of things with it, and it is flowing through the mountain area, it is crossing the plains, it is going up to the sea. Do we have ghat anywhere we want on the river? Is this possible? Ghat are what? The man-made areas, right? So those ghat means where you can approach the river. So ghat are made only at the places where the river is easily accessible or it does not have too much of flow in it. You can definitely feel sensation on your first toe and also on your second toe when you're touching lever 3. So what I'm saying is when the areas on the heavily flowing, fast flowing river also has areas where it is more accessible to human being. Correct? Those are the areas where we make the ghat. Similarly, in the deep flowing, densely flowing meridians, meridians are not simple structures. These are invisible to human eyes. Correct? But still you have very dense energy flowing in those meridians. But there are places in the body where this energy is becoming superficial and then again going deep inside. Those are the areas that have been discovered and mentioned by different scientists through years of hard work, and they have given it names, different names. Okay. One such point is liver 3. So if you see the description also of the name, you will see that this point liver 3 is mentioned as great surge. That surge means force. So there's a lot of force There's a lot of energy stored at liver 3 point. Is this clear? Okay with everyone? What is this point doing? Indications: hepatitis, cholecystitis, cholelithiasis, ascariasis of the gallbladder, lowering high blood pressure, fainting, headache caused by high blood pressure, convulsions of epilepsy, spermatoria, enuresis, amenorrhea, headache caused by hepatic fire, redness and pain of the eye. See, out of all these, at times the description will have too many functions of the point, and 99.9% times therapist will not remember all these things, all the descriptions, because these are random, like random in the sense that it is doing this also, this also, this also. How much will you remember? And especially at the moment when you are treating the patient. So remember only those points which are extremely vital. Remember, liver 3 is an excellent point for any patient who is emotionally derailed. That means emotionally, if you feel that the patient needs more support, do give liver 3. It will help you. It will give you better result with your protocol. So whatever protocol you are giving, apply that protocol. Along with that, apply liver 3 also classically. So on classical location, do not ask me every time. Whenever I say classical, classical means left and right. Okay. And if you are not sure whether to tone or sedate, apply dry PC. If you know what to do with the patient, if there is a protocol, then it is fine. Otherwise, liver 3 sedation also helps. And on the classical, most of the times, yes, it is for so many things. It is not only for headache. You just read out. It is for liver also, gallbladder also. You will see that it is for menstrual problems also. There are so many protocols in which liver 3 is a very common point. Okay, but in emotional cases, you can definitely use, and 70 to 80% of the patients are what? They need emotional support. Okay, this is not modern medicine. This is acupressure or acupuncture, where the patient comes for healing. I said sedate. Sedate this one, liver 3. Now we come to the next point, that is liver 4. So if I move to liver 4, I'll show you the picture of liver 4. Why? Because liver 4 is a location in which we get confused between different points. I'll show you the picture also. So if you see liver 4, there are 3 points mentioned here. See, there are 3 points. What are the 3 points mentioned here? One is SP5, second is liver 4, and third is ST41. See, all the 3 points are very close by, isn't it? There are 3 points: SP5, liver 4, and ST41. Now see this, today's class is very important for everyone who is attending it. Why? Because you will understand where is liver 4 actually. So if I show it on the foot, see on the foot, if you see this meridian is which meridian? Just put it in the chat box. Which meridian is this? This is spleen meridian. Okay, so this is spleen meridian. Which meridian is this on the inner side? Liver meridian. Next to spleen and liver, in Dr. Wall's meridian, those who know Dr. Wall's meridian, so this is what? JD, joint degeneration. Okay, and next to joint degeneration is what? Stomach. So stomach meridian also is coming from the upper part of the body and it is going down. and ending here. So there are three meridians which are crossing the similar area. One is stomach, which is coming to the second toe. This is big toe, the first toe. This is second toe. So this meridian is coming from the upper part of the body to the second toe. Here, this is the location of the next meridian, which is flowing up, crossing this area. This is liver. I'm showing it with second finger. Okay, so this is first, this is second, and third is the outermost, which is the spleen meridian. So you will see that, see, three meridians are crossing the similar area. How many of you have ever felt or seen that many a times, maybe you, maybe your patient complains about swelling in the ankle area. Ankle area swelling is sometimes inner malleolus, outer malleolus, or in most of the times the swelling is here. How many of you have ever seen that or felt that? That this is the area where there is swelling. Also, this is the area where the ankle joint is painful. On your ankle area also, if you give pressure here, if you give pressure here, if you give gentle massage also, do it on your feet. Experience it. See, until and unless we experience it, we will not be able to understand the pain and how the sensations that the patients are feeling. Okay. So just feel liver, spleen, and stomach area. Gentle pressure with your thumb only. No need to use thumb pad. Just gentle pressure on that area, and you will see that this area is little tender. Tender means if you give more pressure, it will be painful. Do you feel that? How many of you are feeling that? Yes, 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 correct. You will find that this area is more tender. Yes, many of you will find that, especially at this area. Why? Because three meridians are crossing here. Now, how to differentiate between the three meridians? Very, very easy. I'll tell you one thing. On your feet now, right now, you find out the area where your finger goes into a groove. In this area, no need to think about stomach or spleen or liver. Just find out a groove here. Like you can find a groove here in between the big toe and the second toe, right? You can find a groove here. Similarly, on the ankle area, here you find out where your finger goes into a groove. Are you able to locate that groove? Let me see if I can show you. Just see, on my feet, I hope I'm able to show you. Are you able to see my? Are you able to see it now? This area? No? See? Now are you able to see? Hmm. So if I show you on my foot, this is what? This meridian is spleen. After that is liver. And inside is what? Stomach. So on the ankle area, if I touch this bony part, keep on finding out on your ankle also. Okay, search on it. Do it right now. So if you touch the inner malleolus, this bone is what? Inner malleolus. Close to that, you just move on the ankle joint. And at a point, you will find that there is a proper groove. See here, I can find that there is a proper groove. This area is more spongy. How many of you are able to find a spongy area? Okay. So if this area, for example, in my foot, are you able to see that my finger is going inside? There is a groove here. This is liver 4. Below that is definitely which point should be there? Obviously spleen. So spleen actually falls on the joint, on the bone. SP5 comes on the bone. Liver 4 is in the groove. And after that, we have the stomach. So we are not talking about stomach right now. We are talking about liver. So we know that liver is in the groove. Is this okay? Is this clear to everyone? Hmm? This is liver 4. Now come to the next meridian. Is liver 4 clear to everyone? See, when we practice, no, that time a lot of queries will come, a lot of questions will come that I don't know if it is right location or not. But with time, your concepts will be more clear. So if you fear that I'm not sure if I have correctly located or the point or not, so I should not put the point, then you are never going to learn. At least have that base that liver 4 is a point in the groove near the ankle joint. This concept will help you in learning more and better with time. Okay, clear? Shall we move to the next point? Hmm? What is the next point after liver 4 is? What is the next point? Liver 8. Yes. Liver 8 is what? The water point. Wood, fire, earth, metal, water. So where is this point? Liver 8. I'll show you the location also. Liver 8 is a point that is little hidden. Under liver 8, it is written superior to the medial end of the popliteal crease. Again, some very difficult points. Superior to the medial end of the popliteal crease. Now, what is the meaning of popliteal crease? Popliteal crease. No, I'm not talking about individual point tone or sedate. So do not ask me liver 1 tone or liver 1 sedate, liver 2 tone or liver 2 sedate. I told you, I gave you some examples in which we are sedating the point or we are tonifying the point in certain problems. Same point can be sedated or tonified according to different ailments. Okay, so liver 4 also depends. Where are you using it? For what different problems you are using it? Liver 4 location is what we are discussing about. Hmm. So it says superior to the medial end of the popliteal crease. Now, what is the meaning of popliteal crease? Popliteal crease means the knee crease. Outside is knee, inside there is a crease. So towards come to the medial end of it, and when you come to the medial end of it, superior to the medial end of the popliteal crease in the depression, anterior to the tendon of name of the tendons are given, posterior to the medial condyle of the tibia, about 1 kun anterior to K10. Now you'll find that so many difficult words and so difficult explanation of the location is given, but it is very easy to understand and locate liver 8 if you see it on the knee. Okay, so I'll show you how to locate liver 8. See, my pant will not go up, so you have to just see it like this. This is what knee, okay? And this is what the knee crease. Like you have the elbow, elbow crease. Backside is what? Elbow. Inside is elbow crease. Crease. This is wrist. This is wrist crease. Crease means the fold where your wrist is folding or your elbow is folding. Similarly, this is the area where your knee is folding. So this is what? This is called the popliteal crease. Now what is mentioned here? In the popliteal crease, superior to the medial end. So it has two ends. This crease has two ends. One is the inside and one is the outside. Correct? So if my leg is like this, the end of the crease, which is close to the body, which is towards the body, is called medial end. This word is very important for everyone. End of the crease, which is towards the center of the body, is called the medial end of the crease. And the outer end of the crease, are you able to see me? Are you able to see me now? So this is the popliteal, I'll repeat it again. This is the popliteal crease. It has two ends. One is this end, other is this end. These are the two ends. So the end of the crease, which is towards the center of the body, is called the medial end of the crease. And this is called the lateral end of the crease. So where is liver 8? Is this here or this is here? Liver is a yin meridian. So definitely it is towards the yin end of the popliteal crease or popliteal area. This is called popliteal area. Okay. So it is towards here. Now what is written after that? It is superior to the medial end of the popliteal crease in the depression. Now, where is this point? This point is in the depression. So here, are you able to locate a depression? Just find out yours. Is there any cavity here? You will see that whole of it is a cavity. Whole of it is a cavity. Okay. So in the very close to SP9 and very close to K10, you move back in the crease and find out a fossa. That becomes your liver 8. Okay. When you are I'll tell you one more point here, which is important, and that is your SP9. So when you are locating, because SP9 and liver 8, both the points are very important points and very frequently used points for knee pain. When you are locating SP9, just come to the end of the knee crease. For yourself also, write down, do it. Just come to the end of the knee crease. This is the end of the knee crease, medial side. Then place your thumb here and move it down. Move it down. Do not bring it here. Do not go back. Just laterally. Place it here and move it down. You will see that your thumb falls into a groove. See, there is it is coming here. And this point is very, very painful point. In most of the patients who complain about knee pain, they will say that my pain started from here. When we will talk about spleen meridian, that time also we will see that this is a junction of many energies. Okay, so do not get confused between SP9 and liver 8. SP9 is lateral side. You can see it here. But liver 8 goes on the back in the groove. Is this okay? Liver 8. Now what is this point doing? What is this point doing? Let us read that. Irregular menstruation, dysmenorrhea, leukorrhea, prolapse of the uterus, pruritus vulvi after pain, seminal emissions, impotency, hernia, dysuria, pain and swelling of the knee, atrophy, debility of the lower limb. So you will see that liver is a meridian which is used in different type of female problems. Like it may be dysmenorrhea, it may be menorrhagia, it may be metrorrhagia, whatever it is. Liver points are very commonly used there. But liver 8, especially as I said, is a very important point for knee pain. Okay. And if you see the location of liver 8 in the biol, you will see that it comes here in the center. So if you are not sure of the location of liver 8 behind the knee, or at times the patients are not comfortable putting the point behind the knee, then you can put a point here also. Biol and classical, both are helping each other. If biol points, you feel that the point is directly accessible on the body, apply classical. If you feel that classical point you're not sure, or the patient is not comfortable with the point, apply biol. Okay, so liver 8 can be applied on the biol also. It also gives very good result. Again, left and right. Okay, so I'll show you the pictures once again. All the 5 points are very easy to locate. 1, 2, 3, 4, 5. This is liver 1. Will you be able to locate and plot liver 1? Just show me a thumbs up. Liver 1. Very good. Liver 2. So liver 2 is also very easy in the web. Simply in the web. Liver 3. Liver 3 is also very easy at the junction of the 2 metatarsal bones. Okay. This is liver 4. So liver 4 concept is also very nice concept, that it is between ST41 and SP5. So don't get confused. Where is SP5 and where is ST41? Just find out a groove. That groove is your liver 4. And this is your liver 8. Liver 8, this diagram, I'm not very happy because it is not giving you too much of clarity. But let me see if I find a good diagram of liver 8. Someday I'll share it. Maybe in the next class I'll share liver 8 good diagram also, so that it becomes clear to you. But you can apply on biol also if you feel that there's some problem there. Okay. So these are all the 5 shoe points of liver 8. If you have any query, you can ask me the question. Now just raise your hand. I'll take you one by one. Sarita ji and then Anjali ji.
नमस्ते मैम.
नमस्ते
मैम, ये जो लीवर 8 की पोजीशन है, यदि ये बायल में बिल्कुल सेंटर में आ रहा है तो क्लासिकल में भी ये नीचे ग्रुप में सेंटर में आएगा या थोड़ा सा
नहीं, बिल्कुल सेंटर में नहीं आता है, बिकॉज वहां पर आप अपने भी नी में देखेंगे तो वहां पे आपको हार्ड लिगामेंट्स मिलेंगे, तो बिल्कुल सेंटर में नहीं आता है.
तो ये थोड़ा मीडियल साइड में जो
थोड़ा सा
पड़ेगा
मीडियल साइड में आता है. यस यस एग्जैक्टली.
ओके, थैंक यू मैम.
Yes, Anjali ji, and then we have Rupa ji.
Ma'am, hello ma'am. What is the exact location of liver 6?
Liver 6. Liver 6 was not there in 5 shoe point, but I'll tell you where is liver 6. Liver 6 is mentioned as 7 kun above the medial malleolus. Medial malleolus, you understand?
Yeah.
This is medial malleolus. So you have to go, yes, you have to go 7 kun from medial malleolus. So what are the 7 kuns? Like how will you measure 7 kun? You place 4 fingers here. This becomes how many kun?
3 kun.
3 kun. Then again you place 3 more fingers. How many kun?
6.
6. After that you place a thumb.
Okay.
And after that you give pressure on the area. You will find that this point is painful.
Actually,
and another thing you should remember is, since there are 2 meridians which are crossing that area close by, one is liver and one is spleen.
spleen.
You
Yeah.
will see that spleen goes behind the tibia. Behind the tibia means it is in the groove of the tibia. Okay,
Okay.
but liver meridian is flowing on the tibia, on the bone.
On the bone.
Yes.
Earlier, I told you I'm sedating this point for lipoma,
Mm-hmm.
liver 6, and I'm
Okay.
toning liver 3 for the same.
Okay. It's perfectly fine. See, these are protocols.
Okay.
Okay.
And I have found changes in that.
That's nice. Very good. Thank you for sharing.
Thank you.
Yes, Rupa ji, and then Om Prakash ji.
Ma'am, liver 8 is not as painful as the other points, ma'am.
Because you are not giving too much of pressure, and do not give too much of pressure there, because it is
Okay.
very close to knee.
Okay,
When you are
because
getting
all
the
the
body
other,
massage done, that time also do not ask a therapist or whoever is doing it, ask
okay,
the person not to touch the knee.
okay,
Okay, because massage on the knee should, if by chance if you are getting it done, it should be done by a very knowledgeable person or who knows the right
Mhm.
process of doing it. Otherwise, this is a very delicate joint that should not be massaged only. Do not get it touched by anyone.
Okay, ma'am. Because
Okay.
all the other points were very painful except
Now, because
liver
this is
8.
a groove, na? You
Yeah,
have
yeah.
to move deep into it, but do not do that.
Okay,
I will suggest
okay,
do
ma'am.
not do that. That is
Okay,
why
ma'am.
I said you apply Biol.
Thank you, ma'am.
Yes, Om Prakash ji. Kindly unmute.
मैम एको पॉइंट में
हम्म,
लीवर 4 जो है
हम्म,
वो जो यहाँ पर रेज्ड बोन्स जो दिखा रहा है उसके पास में बता रहा है, और आप जैसा बताया कि वहाँ जो ग्रुप्स आ रहा है वो ग्रुप्स तो एक करीब करीब 1.5 इंच का है ग्रुप्स, एक सिंगल
हाँ,
ग्रुप।
लेकिन उसमें देखिए आपको एक हार्ड स्ट्रक्चर भी दिखा रखा है।
मैम
आपको मैं आपको दिखा देती हूँ। इसमें आपको एक हार्ड स्ट्रक्चर भी दिखा रखा है। आई शो यू।
हाँ, ये जो रेज्ड पॉइंट है ना मैम,
एक मिनट,
रेज्ड पॉइंट्स के नीचे जो ग्रुप्स है,
एक मिनट, मैं आपको ड्रॉ करके दिखाती हूँ। पहले आप मेरी बात सुनेंगे, फिर आप अपना क्वेश्चन पूछेंगे। हाँ, ये जो पूरा हिस्सा है, दिस होल, इस पूरे हिस्से पर आपको ग्रूव मिलेगा। ग्रूव मिलता है क्या? गड्ढा कुछ है क्या वहां पे?
है
सॉफ्ट
है
एरिया है क्या?
है
है ना? तो जब आप
हाँ
गड्ढे पर सॉफ्ट एरिया खोजते हैं, उसी समय आप पाएंगे वहां पे एक हार्ड स्ट्रक्चर भी है।
हाँ है मैम,
है ये ये
है।
ये हार्ड स्ट्रक्चर।
हम्म
इस हार्ड स्ट्रक्चर के नीचे आना है। हार्ड स्ट्रक्चर आपका एलओसी है। एक साइड इंडिया है,
हम्म
एक साइड पाकिस्तान है।
हम्म।
ठीक है ना?
ओके मैम,
उसके दूसरे साइड चले गए तो ST41 आ गया, और उसके इस साइड आ गए तो लिवर 4 आ गया।
ठीक है मैम।
ये
राइट
बात समझ
सर।
में आई? देखिए, मैं एक चीज और आपको दिखाती हूँ। आपने अच्छा क्वेश्चन किया है। लेट मी ट्राई। कैन यू सी माई फुट अगेन?
या मैम।
सी, इफ यू वांट टू, जो अभी ओम प्रकाश जी ने बात कही, see, this hole is a soft area, okay, but in the picture, in the diagram, you saw that there is a tendon mentioned here, है ना? ऐसा दिखा रखा था ना एक हार्ड स्ट्रक्चर यहाँ पे। हाउ टू लोकेट दैट हार्ड स्ट्रक्चर? यू पुल योर लेग बैक, और फिर देखिए यहाँ पे एक बहुत हार्ड स्ट्रक्चर आपको फील होगा। देखिए, ऐसे करने से हो सकता है आप उसको मिस आउट कर दे, बिकॉज यहाँ फैट डिपॉजिट होता है। आप इसको पुल करेंगे तो देखिए देयर इज अ हार्ड स्ट्रक्चर, वेरी क्लियर। आई कैन फाइंड ऑन माई फीट दैट foot that this is a hard structure here. अपना करके देखिए, pull your just flex it inside and you will find that there is a hard structure here. So below that is liver 5. कितने लोगों को
ओके
ऐसा मिला है? बस वैसी.
ओके मैम, थैंक यू,
ठीक है ना?
थैंक यू।
Any other question? So since everyone is clear, I hope next year we'll take next class. Whenever we have the classical location class, we'll take next meridian. Yes, Kanchan ji, do you have a question?
यस मैम, लिवर 8 बस थोड़ा सा ये जो हार्ड स्ट्रक्चर यहाँ भी आ रहा है ना ग्रूव के मीडियल साइड में, तो
हाँ.
ये हार्ड स्ट्रक्चर के अंदर है ना लिवर?
करेक्ट, हार्ड स्ट्रक्चर के अंदर है.
ओके मैम.
मैं देखती हूँ, मुझे अगर अच्छा डायग्राम मिलेगा, उस पिक्चर में बहुत क्लियरली नहीं समझा पा रही हूँ, और पैर के पीछे दिखाने के लिए मुझे एक डायग्राम चाहिए. तो इफ आई गेट अ गुड डायग्राम इन द स्प्लीन क्लास, आई शो यू.
ओके ओके, और बाकी
हाँ,
बहुत अच्छे
क्योंकि
से.
हाँ जी जी, ऐसे ही करके देखिए, समझते जाएंगे. हो सकता है 100 में 100 सब लोग ना समझ पाए, लेकिन जितना भी समझ रहे हैं ना, उसको समझकर प्रैक्टिस करना शुरू करिए. क्लासिकल पर करते करते चीजें जो है फाइन हो जाएंगी. आप सोचोगे एक ही बार में मैं 100% सीख कर ही मैं प्रैक्टिस करूं, तो वो समय पता नहीं कब आएगा. तो जितना भी समझ रहे हैं ना, उसको समझ के प्रैक्टिस करते जाइए, तो खुद को लगेगा कि अरे हाँ, 5 लोगों के ऊपर करेंगे. जैसे ओम प्रकाश जी, आप 5 लोगों के ऊपर लीवर 4 को लोकेट करेंगे, तो 5 लोगों के एरियाज को आप पैल्पेट करके जब देखेंगे, तो आपको समझ में आएगा आप सही लगा रहे हैं कि नहीं.
मैम
ये बात क्लियर हो रही है?
यस यस
हाँ.
यस.
जब नाड़ी परीक्षा मैंने सीखा था, तो मेरे गुरु ने कहा कि जब 200 लोगों के ऊपर में पल्स को टच कर लोगे, तब तुमको समझ में आएगा कि पल्स होता क्या है. सीखोगी नहीं, सिर्फ तब पता चलेगा कि पल्स होता क्या है. वैसे ही जब हम क्लासिकल पॉइंट्स को, अभी तो जो थ्योरी था उसको हमने कन्वर्ट किया है प्रैक्टिकल में. प्रैक्टिकल में भी हमने उस चीज को सिंप्लीफाई किया है ना. हर चीज को हमने सिंप्लीफाई करके समझा. जब इसको हम 5 7 10 लोगों पर उस क्लासिकल लोकेशन को जब हम टच करते हैं, उसको फील करते हैं, तब हमें समझ में आएगा कि हम करेक्ट कर रहे हैं कि नहीं. तो करिए, सब लोग क्लासिकल पर अप्लाई करेंगे.
मैम ये है ना LV8 को अगर अपने बियल पॉइंट्स में दे तो कहाँ पे एग्जैक्टली आएगा?
चार्ट में देखिए, बियल में
हाँ,
देखिए कहाँ दिखा रखा है चार्ट में. यहाँ पे आप देखोगे, इस जॉइंट के मिडिल में दिखा रखा है लिवर 8.
तो मैम जैसे आपने बोला ना कि LV8 को किसी को भी टच नहीं करना चाहिए क्लासिकल पॉइंट में, इट्स
नहीं नहीं,
वेरी
मैंने
डेंजर.
ये नहीं बोला. मैंने कभी भी ये नहीं बोला कि आप टच नहीं करना चाहिए. मैंने
ओके.
बोला कि नी की मसाज नहीं करानी चाहिए. और लिवर 8 पर मैं इसलिए अभी बहुत ज्यादा एम्फोसिस नहीं दे रही हूँ, क्योंकि बहुत ज्यादा प्रेशर वहां पे गलत तरीके से नहीं पड़ना चाहिए. हम तो
जैसे
लगाते ही
किसी
हैं, हम तो एक्यूपंक्चर भी करते ही हैं लिवर 8 पर क्लिनिक में पेशेंट्स के संग में, लेकिन इट शुड बी
जैसे
करेक्टली डन, है ना.
जैसे किसी के अगर नीज में पेन हो एंड
तो आप
लाइक
बियल
आई
पे
एम
लगा दीजिए लिवर 8.
बियल पे लेबर 8 पे यूज कर.
बिल्कुल.
इट कैन बी मतलब आपका जैसे होता है कि फॉर एग्जांपल जैसे मैं जॉब करना स्टार्ट की एंड आई हैव थोड़ा सा टेम्पररी काइंड ऑफ पेन इन माय नीज, तो उसमें भी लिवर 8 में यूज कर सकते हैं बियल में.
आपकी बात बीच में अटक गई थी, क्या बोल रहे हैं? अगर आपने
जैसे मैंने अभी जॉगिंग चालू किया है एंड
जॉगिंग,
थोड़ा सा, यस, एंड थोड़ा सा
डू
मुझे
नॉट
नीज
डू
में.
दैट. आप मत करिए, क्योंकि आपकी उम्र 30 ईयर से ऊपर हो गई होगी,
यस यस.
और आपने अभी शुरू की है जॉगिंग.
नहीं नहीं नहीं, आई एम
ठीक है.
रेगुलर इन दैट. आई एम रेगुलर इन जॉगिंग
रेगुलरली मीन्स सिंस व्हेन आर यू डूइंग इट?
फ्रॉम पास्ट 10 years, बट लाइक अभी बीच में लाइक 2 3 months मैंने नहीं किया ड्यू टू सम वेरी रीजन. अगेन आई स्टार्टेड. तो अपने टेम्पररी होता है ना कि बहुत दिन बाद आप करते हो, तो देयर इज एक दिस अनकंफर्टेबल इन योर जॉइंट्स. तो उसमें भी क्या हम लिवर 8 यूज कर सकते हैं पॉइंट्स?
लिवर 8 आप कर सकते हो, बट स्टिल आई विल से कि आप बहुत स्ट्रेनर्स या बहुत प्रेशर देकर आप जॉगिंग मत करिए. ओके, बिकॉज विद टाइम अगर डिजनरेशन होता है, तो उसका इफेक्ट घुटनों पर दिखाई देता है. हम्म, ठीक है. So that is all for today. Next day we'll again meet for the next topic. Thank you so much, everyone, for joining. I hope this class was useful to you. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you,
Thank
Dee.
you,
Thank you.
ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you so much, Anjali.
Thank you, ma'am.
Thank you.
Thanks a lot, ma'am.
Thank you.